If you are over 60, you may believe that slower steps, unclear speech, or sudden headaches are simply a normal part of aging. But the truth is, many of these so-called signs of age are actually silent warnings of an impending stroke. I have seen far too many patients who ignored the early whispers of their bodies until it was too late. A stroke is not just another illness. It is a medical emergency that can steal your independence, your memory, and even your life in a matter of minutes. You may think it only happens to people who smoke heavily or drink too much, but strokes strike millions of seniors every year who thought they were doing everything right. The good news is that stroke is not inevitable. By understanding its types, symptoms, causes, risk factors, complications, and preventive strategies, you can protect your brain, your heart, and your future. In this video, I will walk you step by step through the 7 essential truths about stroke that every senior must know. These lessons could save your life or the life of someone you love. Before we dive in, if you have not subscribed yet, I recommend you hit that button and turn on the bell so you never miss another health tip made just for you. If you enjoy this video, type 1 in the comments. If not, type 0 to let me know how I can make better content for you. Now, let us begin with the very foundation, what a stroke really is and why it matters. Part 1. What is a stroke and why it matters? A stroke occurs when the brain is suddenly starved of blood and oxygen. Without these essentials, brain cells begin to die within minutes. This is why doctors often call stroke a brain attack. Unlike other organs, the brain cannot store oxygen or nutrients for later use. Every second counts. There are 2 primary forms. An ischemic stroke happens when a blood clot or fatty deposit blocks an artery supplying the brain. This is by far the most common type, representing nearly 85% of all strokes. A hemorrhagic stroke is caused by a blood vessel that leaks or bursts, flooding the brain with blood and creating dangerous pressure that destroys tissue. There is also what we call a transient ischemic attack, sometimes known as a mini stroke. Although the symptoms may last only a few minutes, it is a red flag that a major stroke may be on the horizon. What makes stroke so dangerous is its suddenness. One moment, you may be enjoying breakfast, and the next you cannot speak, move, or see clearly. Stroke is one of the leading causes of disability in older adults, leaving millions unable to walk, talk, or live independently. Yet many of these outcomes can be prevented with awareness and quick action. Research published in The Lancet shows that rapid treatment within the first golden hour can cut the risk of permanent disability by more than half. The reason stroke matters so much for seniors is that age is the strongest risk factor. After 55, your risk doubles every decade. But do not mistake risk for destiny. Lifestyle choices, medical management, and vigilance can dramatically lower your chances. If this surprises you, wait until you hear about the different forms stroke can take and why knowing them could save your life. Part 2. Types of stroke. There are 3 main categories every senior must understand. The first is ischemic stroke. This is caused by narrowed or blocked arteries that choke off blood flow. The blockage can be due to a clot that forms in the artery itself, often after years of cholesterol buildup, or a clot that travels from the heart, such as in people with irregular heartbeat, called atrial fibrillation. When that clot lodges in a brain artery, the cells beyond the blockage suffocate and die. Patients often describe sudden weakness on one side of the body, slurred speech, or loss of vision in one eye. The second category is hemorrhagic stroke. Here, the culprit is not a blockage but a rupture. High blood pressure, trauma, or weak spots in arteries known as aneurysms can all cause blood to spill into or around the brain. The flooding increases pressure, compress vital tissue, and creates a storm of damage. Symptoms may include a sudden thunderclap headache, nausea, vomiting, or collapse, although less common. Hemorrhagic strokes are often more deadly. The third category is transient ischemic attack. Unlike full strokes, the blockage is temporary, sometimes lasting only 5 minutes. But do not be fooled. A thanks in advance is a serious warning sign. About 1 in 3 people who experience a thanks in advance will go on to have a full stroke, many within days. Scientists from the American Heart Association have found that early recognition and treatment after a thanks in advance can prevent up to 80% of future strokes. The takeaway is clear. Know the types, recognize the signs, and never dismiss temporary symptoms as harmless. If this knowledge startled you, the next section will teach you how to recognize a stroke as it is happening and what to do in those crucial first minutes. Part 3. Symptoms and emergency response. When it comes to stroke, time lost is brain lost. Recognizing the symptoms quickly can mean the difference between recovery and lifelong disability. The most reliable tool is the FAST method. Face, arms, speech, time. Ask the person to smile. If one side droops, that is a warning. Ask them to raise both arms. If one drifts downward, danger is present. Listen to their speech. If it is slurred or strange, it is another red flag. And the most important step, do not wait. Time means you must call emergency services immediately. But symptoms extend beyond FAST. Many seniors experience sudden vision problems, such as blurred or double vision. Others may feel a crushing headache unlike anything they have ever had, often accompanied by dizziness or vomiting, trouble walking, loss of balance, or unsteady coordination are also common. What makes stroke especially cruel is that it often strikes without pain. You may feel confused or off balance but not realize that brain cells are dying each second. The Mayo Clinic emphasizes that even if symptoms fade away, you must treat it as an emergency. Waiting to see if things improve is the most dangerous mistake. Every minute of delay allows millions of neurons to die. For ischemic stroke, clot-busting drugs are most effective when given within 4.5 hours of onset. And sometimes mechanical procedures can remove clots if done early. For hemorrhagic stroke, rapid intervention can reduce bleeding and lower pressure. The lesson is simple. Learn the symptoms. Act immediately. And never downplay the signs. If you thought stroke only looks dramatic, wait until you see how silent risk factors build up over years before the first attack strikes. Part 4. Causes and risk factors. Stroke does not come out of nowhere. It is the result of both controllable and uncontrollable factors. Lifestyle risks include obesity, lack of physical activity, heavy drinking, and drug use. Medical risks are equally important. High blood pressure is the single most powerful cause, responsible for nearly half of all strokes worldwide. Smoking and secondhand smoke damage blood vessels and double your risk. High cholesterol creates fatty deposits that narrow arteries. Diabetes injures vessels and increases clot formation. Heart conditions such as atrial fibrillation allow clots to form in the heart and travel to the brain. Sleep apnea, often undiagnosed in older adults, interrupts breathing and raises blood pressure at night, straining the circulatory system. There are also demographic risks. People over 55 face much higher odds. Men experience strokes slightly more often, but women are more likely to die from them. African American and Hispanic seniors have a greater risk compared to other groups. Hormonal factors, such as estrogen therapy, can increase vulnerability. Even infections like COVID-19 have been linked to higher rates of ischemic stroke. Some risks cannot be changed, but many can be managed or reduced. A study in the New England Journal of Medicine revealed that up to 80% of strokes could be prevented by controlling just 5 factors: blood pressure, smoking, diet, physical activity, and weight. Understanding your risk profile is the first step, but what happens if a stroke does strike? The consequences can be devastating, and that is what we will uncover next. Part 5. Complications. After stroke. A stroke does not end when the hospital stay begins. Survivors often face lasting complications that reshape their daily lives. Paralysis or weakness on one side of the body is common, making walking, dressing, or eating difficult. Damage to the muscles of the mouth and throat can create problems with speech and swallowing, leaving patients frustrated and socially isolated. Memory loss and difficulty thinking are frequent, with many patients struggling to plan, reason, or even recall familiar names. Emotional challenges are another burden. Depression, anxiety, or sudden mood swings often follow strokes, as the injured brain struggles to regulate emotions. Pain, numbness, or unusual sensations may linger, especially in the arms and legs. Even basic self-care can become overwhelming, requiring assistance with bathing, grooming, or cooking. Families often feel the impact as much as patients, watching their loved ones change in ways they never expected. But complications are not just physical or emotional. They also increase vulnerability to further health crises. Stroke survivors face higher risks of infections, falls, and another stroke. Yet within these hardships lies an opportunity. With rehabilitation, therapy, and support, many regain significant function. Physical therapy helps rebuild strength. Speech therapy restores communication. Occupational therapy teaches new ways to adapt. The National Institutes of Health reports that nearly 2/3 of stroke survivors achieve meaningful recovery with proper care. Still, prevention remains far better than recovery. So let us now examine the strategies that can reduce the risk before stroke ever happens. Part 6. Prevention and treatment options. Prevention is the most powerful medicine. Controlling high blood pressure is the cornerstone. Regular monitoring, lifestyle changes, and medication when needed can cut risk dramatically. Lowering cholesterol through diet, and sometimes statins, prevents arteries from clogging. Quitting tobacco immediately reduces risk, no matter how long you have smoked. Managing diabetes with careful diet, exercise, and medicine keeps vessels healthier. Maintaining a healthy weight eases strain on the heart and brain. A diet rich in fruits, vegetables, whole grains, and lean proteins, similar to the Mediterranean diet, is strongly protective. Regular exercise, even brisk walking for 30 minutes a day, improves blood flow, lowers pressure, and strengthens the heart. Alcohol should be limited, ideally to no more than 1 drink per day, if at all. Treating sleep apnea with appropriate devices prevents nightly surges in blood pressure. Avoiding illicit drugs is essential. For those who have already had a stroke or a thanks in advance, medications play a crucial role. Antiplatelet drugs such as aspirin make clots less likely. In some cases, anticoagulants like warfarin or newer options such as apixaban are prescribed to prevent clot formation in high-risk patients. Emergency treatments are equally important for ischemic stroke. Clot. Dissolving drugs and procedures can restore blood flow if delivered quickly. For hemorrhagic stroke, surgery may be required to stop bleeding or relieve pressure. Every option depends on fast action. But beyond medicine, stroke prevention is about daily habits. Breathing deeply, managing stress, and staying socially connected all support resilience. Awareness, preparation, and commitment turn risk into opportunity. And that brings us to the final, most important lesson. Part 7. Conclusion and key takeaways for seniors. Doctor's final words. A stroke is not just an event. It is a turning point. For some, it ends independence. For others, it begins a new chapter of awareness and healing. The difference often lies in choices made before the crisis arrives. You have the power to shape that difference. By knowing what a stroke is, recognizing its symptoms, understanding the causes, respecting the risks, and committing to prevention, you can dramatically reduce your chances. Do not dismiss sudden weakness, slurred speech, or blurred vision as simple aging. Do not assume tomorrow will offer another chance. Every moment matters. The body may age, but it still remembers how to heal if you give it the chance. The truth is, you are not powerless. Every choice to walk, to breathe calmly, to eat wisely, to take medicine as prescribed is a choice to protect your brain and your future. Share this message with someone you love because awareness can save lives. Now, I would love to hear from you. Take a moment to reflect and share one thing you have learned and plan to apply in your own life. Let us support each other on this journey toward embracing these truths. If you enjoyed this video, comment 1. If not, comment 0. Do not forget to like, share, and subscribe for more content like this. Thank you for watching, and here is to living life on your own terms. Doctor's final words. A stroke is never simply bad luck. It is the end result of choices, risks, and silent triggers that gather strength over the years, until one day the brain can no longer resist high blood pressure, excess weight, poor sleep, harmful foods, smoking, alcohol, and inherited risks do not act loudly. They act quietly, in the background, eroding the foundation of your health. What I want you to remember is that your body still holds an incredible power to heal. The human brain, even after decades of stress, wants to be protected. The heart, even after years of pressure, wants to beat steadily. The blood vessels, even after exposure to strain, still have the ability to recover. But they need you to make a decision today. Too often I see seniors waiting for the diagnosis before taking action, waiting for the warning before changing course. The truth is that every day you delay, the risks climb higher, yet every small step you take in the right direction lowers those risks more than you realize. Choosing a balanced meal of vegetables and whole grains instead of processed food lowers your pressure. Walking just 15 minutes each day improves circulation in ways no pill can fully replicate. Turning off the cigarettes, limiting alcohol, and taking sleep seriously rewires your body back towards safety. Even if stroke runs in your family, your daily actions have the power to silence that genetic voice. I know the fear of stroke can feel overwhelming. The image of losing speech, of not recognizing loved ones, of struggling with simple tasks can paralyze many seniors into denial. But fear should not freeze you. It should fuel you to act. Imagine the gift of holding your grandchild with steady hands, of walking to the park with confidence, of telling stories with a clear mind well into your 90s. That is not a fantasy. That is the reward of prevention. Your future does not need to be dictated by hidden triggers. You are not powerless. You are not too late. And you are not beyond hope. Each breath is an opportunity to protect the brain that carries your memories, the heart that carries your life, and the body that carries your independence. Share these truths with someone you care about. Start today, not tomorrow. And remind yourself each morning that you are worth the effort. Because strength and clarity can still be yours if you choose to protect them now.